Um, our agenda, we've got 5 things that was sent out in our email. We've got some updates on automation planning. We're going to talk about some new sites, difficulties that we've encountered, and then current updates that are scheduled in SID policy and procedures. So the first one is kind of the ongoing discussion, and we talked about it at the board meeting the other day. One second. We have some electrical cords in our hands down here. There we go. We talked about it in the board meeting the other day, as well as the meeting that we're anticipated to have and a little bit later. But essentially, it's the ongoing discussions about how to automate. And so to put things in perspective and bring it right up to speed, the direction that I'm pushing for automation at this point is the automation to have an API built that will automatically pull the daily vitals, analgesia, and events data from our patients, some of which can be in-house for as many as 21 days. And we're pulling somewhere along the lines of 20 to 40 data points per day in the hospital. So the estimation that I gave to the board is that this would be a 50%, a roughly 50% improvement in the amount of time needed for the clinician to enter data into SID, or for whomever is entering data into SID. I've spoken with Jonathan about this. It's a shame he can't be here today, but he has said that he's been able to dabble with this process in Cerner. However, for the prototype, we would like to do it in Epic due to the 3 most common places, the 3 highest data entry sites, all using Epic, and those being a test platform. The details of that still need to be fleshed out. There are data privacy details that need to be sorted out. There's technical details at a site level, and then infrastructure that needs to be built into SID. But from just casual discussions that I've had with our engineer, this does sound like an attainable process. It does also carry a price tag with it, which we haven't yet elucidated, but that's the ongoing discussion that we're having regarding automation. So
Chris,
yeah, go ahead.
Can I just make a thing? I don't want my opinion on this to overbear what you're saying.
Yeah, no, go ahead.
There's basically sort of 3 ways to look at this. There's as you suggested, an API. There's an app edition, which is this new concept that Epic is running. And then there's the third one, which is like, basically non-automation, which I don't think is an option. But in terms of the API, the 2 things for me that worry me about the API are a true API is going to require a lot of tech support at each individual site that we employ. Now, when we employ that for the 3 biggest users, that's not going to be that big of a deal. But in terms of scalability for the society, I'm a little bit worried about that. The second thing is that Jonathan hasn't built this API in Epic before. So there's going to be a pretty steep learning curve for him to do it. The second, and we rely on Jonathan. The app technique is an interesting concept where Epic is allowing third-party companies to basically build APIs like you're talking about. But what's nice about them is when you get to a different site, it's just a download that they can download and install at their site. So there's no need for local tech support to employ that at each individual site. So there might be more of an upfront cost in terms of the development, but we could do it with a company, number one, that has built one of these before. Number two, we could deal with a third party company that might be a little bit easier to manage, and Jonathan has been. And three, in terms of scalability, it might be a better option. And I think really what we're going to have to weigh is sort of the cost of that deployment versus the scalability and ease going forward. So it's just, it's a similar type of thing. It achieves the same goals, but the way in which we get there may be better in the long term, I guess, is sort of what I'm trying to get at.
Yeah, I agree with those points entirely. To answer some of those questions, the way that Jonathan is going to be discussing doing this was with a contractor because of the Epic issue. So that's the first part. The second part, whether we go with a hard-coded API or whether we go with an app that's been developed by a third party, either one is appropriate. But we don't have a cost analysis yet on this, and I think part of that's going to be dependent upon what Jonathan finds out from his colleague that is familiar with Epic. And so I'm waiting to hear back from him on that end.
Yeah, I know he needs to find that person that he's got to find somebody who's built the API and the app. I understand that. So, but I guess my point is that we might have to make a decision to get, as a committee, the committee may have to make a decision and present just one option to the board and say, in terms of the long term, and again, I keep using this term, but it's super important, is the scalability of the project. Because again, I mean, as I mentioned to Sarah, I am a little concerned that no matter how easy we make it, it's still going to be the same number of hardcore sites that are contributing. So the question is, if it's only going to be 10 sites, is it worth doing that? Depending on the cost, it might not be worth worrying so much about the scalability. So it's just something we'll have to answer that we should answer as a committee before it goes to the board.
Absolutely. I know there was a lot of at least verbalized enthusiasm for SID at the meeting. However, that verbalized enthusiasm doesn't necessarily translate into new sites. And I think that actually is a good segue into the next point about new sites. Sarah Ann, do you have any information on new sites that are along the process?
So I have checked in with our two people that both indicated interest as of late. And the one who, I mean, Dr. Martinson seems pretty motivated to make it happen. I think he's going to be, I don't know, it's just taking a little bit of time on their end. We're not, there haven't been any requests for contract changes or anything like that, but I'm hoping that will be forthcoming. I know Dr. Crisco, he's our other one. He is trying to get it implemented on his side, but again, just working through the approval process. I did hear from Dr. Akashik Mukherjee at Loma Linda on Friday to say that he's super interested and wants to have a discussion. So I think, we've still got people thinking about it, or at least, getting excited about it, which is great. I know after the board meeting, Dr. White and I had a conversation, just a subsequent about, kind of what this looks like from the 50,000 foot view. And he was asking, he's unfortunately unable to join us today. He's out of town, but was saying, do you think you guys should consider not onboarding anyone until we at least have a plan? Or at least, have a decision made or something like that. And I said, well, all of these move so slow. It's not like something's going to happen overnight and we're suddenly going to be, scrambling or whatever. I said, they usually take multiple months. And, so I don't expect it to be a problem before the board, before we come up with our solution and then present it to the board. But he said, well, if anyone looks like they're getting to that final point, let's have, a more specific conversation about should we be bringing people on without really a solution, that's a little bit easier for them. I think, some of the hesitation that he's expressed is just in getting people that are excited. And I think it's, I shouldn't say just him, it's one of my concerns too, getting people that are enthused and excited, like ready to go. And then they actually launch into it. And then it's more cumbersome or more time consuming than maybe they really were anticipating. And then kind of losing that
it'd be worse
enthusiasm.
to get them going and then lose them.
Yes, that's kind of what we were thinking, is losing their enthusiasm at that point would be more destructive than just telling them like, hey, let's sit tight for 6 months while we figure this out, or something like that. So I'm
Gotcha.
not actively churning anything. Whereas before I was like reaching out to people and be like, hey, do you want to get involved? And, like trying to get them to do it. Now I'm just responding when people do ask, but I'm not, really pushing it.
As an idea, and I'd love to hear your thoughts on this, Andy. If we are getting to that final stage where a site is ready to join, ready to jump in with both feet, would it be appropriate or reasonable to have them sit in on the next meeting that this group has?
Yeah, I mean, I think that would be great. And I think, I mean, I feel a little differently about the way Tom and Sarah feel. I think if people know going in that it's going to be cumbersome and they do a little bit here or there and they put in a couple people versus putting in everybody, I still think it contributes to it. And then they'll just appreciate when it's automated that much more, as long as they know going into it what it is, and I think somebody like Mark Kriskow, for example, who's super motivated, will do it. And I think that that's okay. We do have some of those things like we have, which is the semi-automated thing, or someplace like Mark, where he's a fairly small center, or Kurt can use some of those things to get a couple people in. And even if they don't get everybody in, but they get some in, I think that's still better than nothing. Again, just knowing what they're in for. Don't blindly be like, oh yeah, it's no big deal. And then just like, whatever. I don't know. And I do think having them start sitting in on it before they start to employ it would be helpful.
That was actually part of the conversation that I had with Rich Lesperance. I'm not sure how far along he is with that, and I know that's a government institution, but he was definitely interested in pushing things forward despite the bureaucracy of more of a governmental hospital, but also wanted to see just what sort of roadblocks he was anticipated to encounter. So, all right, so we've got a group that sounds like maybe 4 sites that are coming up and interested. I know there are some that are waiting out there. Certainly Erasmus was one of those sites that is kind of waiting in the wings. And so it feels like a lot of this is hinged upon our optimization and our success towards that optimization and automation that we've been working towards.
I don't have Mayo on my on my list of people to come, but they did agree to everything in the agreement. Then they just backed out when they realized the time commitment, or when they really, started analyzing who was going to be doing that. So I think there are some, I guess I should say, kind of some sleepers, that would definitely pop up if it were easier. I know I have a few people that are on that list of like, well, call me when it gets better. I'm like, okay, so I think we do have a significant amount of, or we could have a significant amount of momentum once we get, to that next phase.
Yeah, and Sarah, I think those people are exactly who you're talking about, where you wouldn't want to bring them on
Yes, I agree.
beforehand. but somebody like Mark might be a different animal. That's what I mean. So I definitely
Yeah.
think there's going to be the hardcore people, like those of us in it already, the
Mhm.
fringe people, and then the soft people. And it's the fringe people that you really need to be careful about bringing them on beforehand.
I think that makes sense. I think too, I know Dr. Bauman and Dr. White are both in a situation where they just don't have any resource of someone to help. And so I was talking to both of them about doing kind of the upload like Dr. Antipa did, because they both have separate data solutions, that they're keeping on their own. And, this idea of if we could have one common template or one thing that people could fill out and at least get, a certain portion of the information in. Obviously, it's not, I know you guys have put a ton of energy into getting them in, but at least if it started that ball, that then they would be able to then complete records, or get someone to help complete records, but that it might help get over that initial hump. So I told both of them, that let's discuss that when we do the call next week, in terms of if Jonathan could have even a template that, or something that he could start with, they could start with to get that process going.
So we've had
we'll see.
we have a template. It's on it's on
Yeah.
SID. It's been downloadable for a long time.
But isn't it only for one of the systems? I can't remember which system it's for.
Nope. It's a blank template,
Okay.
and you map your fields in.
Okay.
The issue is you still have to map your fields in, and both Tom and Zach have very rudimentary databases with very rudimentary data entry, with very rudimentary data fields in.
Yeah.
And so they certainly can do it, but it's not gonna control what it is they want. What they're gonna want out of it. And then they're gonna have a whole bunch of people, but if we pull data fields out of it and want to look at narcotic use or daily outcome things, they don't have any of the daily outcome stuff.
Yeah,
So
it would be filling the database with incomplete data at best.
Well, I think it's at least worth a discussion in the meeting if there's a better way for us to make this happen. Because I think if we know there are two sites that are super excited about or super anxious to start doing it, even if I can get them the template, I'll work on downloading that template and get it over to them. But even if they could see where it would start and then, from there kind of allocate resources or identify how much more needs to be done to carry the ball forward. I think they both just kind of need something to move it, when you're kind of stuck on something and you just need an initial push. And this may be a thing that can help them see even a little bit of success and then build from there.
that's the Excel data template that's on the SID website. And the other argument is they could fill out the fields that they fill out in their stuff and download it and transfer it back in too. I mean, it's the same argument. And I had that discussion with Sarah Majercik a long time ago. I said, why don't you just fill out the fields that you fill out in yours in SID and download it on whatever day. I mean, and now you can download at any time you want for free. At any time you can download your own data. You don't have to call anybody. You just click a button and just hit export data, and you can get your own data set right out.
Yeah, that may be a good solution for them as well. I'll discuss both of those with them.
What was the next thing that we had on our list?
Difficulties encountered was what you had noted. I'm not sure if that was attributed to something else.
Oh, no, I think that was wrapped in with the automation planning, and that's going to be part of the discussion that we're going to have with Jonathan and as a side group as we sort out the path forward for this automation.
Gotcha. The next one is just current updates scheduled. I know we have there were a couple of items that he was working on in the last year where he'd submitted proposals, we'd approved them, and moved them forward. But I'm not sure if they're all finished or if we're still waiting for any other updates that you guys are aware of. I was still waiting for the basic parameters, the ones that you designed, Dr. Janowak, that then he was going to go in and make those changes. I haven't seen any notification if that is done, and I'm not actively going into like try to put in a BMI of 1,000 or something like that. So I don't know if they are complete, but I just wanted to check with him about where that is, because I think there were a couple of those updates too that we were supposed to pay him for, and when I've asked, I haven't received any follow-up, so I'm not sure if we owe him money. So I'm not sure, maybe they're just not done, and that's why I haven't heard about an invoice. I don't know.
Is there a list that's kept anywhere about what updates are pending or what?
So
What things
heretofore,
are
there
on-
hasn't
yeah.
been. I've just run off the proposals that he's submitted. But
Okay.
I was thinking about it this past week, and given that I didn't know the answer to that question myself, I decided I was going to just build a quick spreadsheet and stick it, in Google Docs, and then I'll share it with all of you guys so that we have a little bit better transparency about, kind of the project, what's anticipated, the anticipated cost, and then a timeline.
Okay,
Because I think that may be part of the issue, and I'm just a little bit nervous about, none of the proposals we approved were super expensive, but I also don't want to, suddenly have a bill that we haven't paid or something like that, or have it be kind of expensive at that point. So I will finish putting that together of the things that I'm aware of, but need to know from Jonathan which ones are actually finished, because sometimes I'm not as familiar with the actual task at hand, or if it's been done, because I'm not actively putting people in.
Sarah, two things about that. I love the idea about a Google spreadsheet, and the way the documentation currently runs with us. It's like Fred, not when the database chairs could approve things that were under. I forget what it was. There were some numbers there that were.
I think it's
set.
3,000. Yep, I think it's
I think it's
3,000 a year.
I think it's 3,000 per and 10,000 a year or something
that's
like
right.
that.
Yes.
So
Yep.
The thing that I would recommend is why don't we put like a column in there that says approved by database chair or whatever, or requires larger approval.
Yeah.
Part of that was that way we couldn't get stuck. You wouldn't get stuck with a huge bill without knowing that it was coming.
Right.
Yeah.
Well, and
yes,
I
we
feel
could
like
do,
that's
you could
kind of
have a
where
couple
I am
columns in
now.
there.
I know
Right.
I think there were 2 or 3 proposals from last year, and none of them were more than 1,000 a piece. So it's not like we would owe him a lot of money, even if,
Right.
if, but
But it's good for you to know what's
in payment.
outstanding.
Yeah, exactly.
Right.
So I'll
Yeah.
get that completed and then share that
I
with
know
everyone
that
in case you or Dr. Parachi have any other perceptions. I know we shared those proposals last year, and then you guys would vote to approve them and stuff. So I'll put
Yeah.
all of those on there, but I feel like at least 1 or 2 of those items did get finished.
The repeat fracture grid and the repeat CT scan, the repeat fracture grid was definitely redone.
Okay.
And I think there was like a readmission thing. There were a couple of little checkbox stuff that was definitely done.
Okay.
But I thought most of the parameter stuff was done. I definitely got an error putting something in the other day that I was a little bit, that I was surprised was done because I didn't think it was.
Okay.
Russ may know too.
Well, I'll go through
But
my
I don't know
folder
if
of
all the
emails of things I sent to you guys for approvals, or where, we had a proposal and then it was approved, and just get that cleaned up. And then I'll send it back out to the committee in case anyone is aware of something that wasn't on my radar screen.
yeah, I would love to see that list. And I think one of the things that this committee should be transformed into is holding accountability to getting these things done. Because if it just turns out to be vapor or paperware, we're not making any progress forward. So yeah, I'd love to see that. If there's not anything else with the current updates, I think that actually also transitions into this last point about the SID policy and procedures. So far, I've got a brief working draft going for this. The idea behind this is to create a way for not self-governance, but a way to sort out some of the questions that we're encountering. The idea behind this came from a conversation that Sarah and I had a few months back, which was about who has access to the database and for how long and for what purpose. And as we mature and as we grow, questions like that are going to become more and more germane, especially because we don't have a locked data set at this point, especially because we don't have formalized pathways for accessing the data, for data entry, timing of that. And all right, thanks, Andy. So the basics behind this policy are answering the questions.
No problem.
Why, what, who, where, and when. And to be more specific about that, the why is going to be a statement of intent, which will be essentially a mission statement that anybody else would be able to use that shows what our guiding light behind this project is. And it's an ongoing project. I would think of this constantly as in a beta sort of stage where we're testing, growing, expanding until no particular endpoint, until we have a product that people can mine for appropriate data. The what questions are, what are the purpose of the SID, which then defines or would give us a guideline for how we move forward to expand and create opportunities within SID. What also would be a more formalized statement about data that is collected. So we currently do have a data dictionary, but what we need to do if we're going to be a legitimate research-based and process improvements or performance improvements-based database is we have to have that that dictionary published. Not necessarily published in a publication, but it has to be accessible and it has to have clear definitions behind it. Those definitions can be evaluated and changed as need be, but they have to exist, just like the National Trauma Data Bank, just like the Trauma DRGU does, just like NISQIP or any of the other major databases. They all have definitions. And when you're doing research based off of this, it has to have a firm definition for a data field. We ran into this about a year ago, Dr. Prinz, when we were doing a lot of data monitoring, and we started to see that people were accidentally putting in, for instance, a BMI of 1,000. Now that just can't exist. But what we could do is we could create data fields that are have barriers on them, and we have a working set of that we're trying to input into the database. But if we were able to put that into our data dictionary, and the data dictionary is then publicly searchable, that gives the database as a research tool that much more credence. The who would answer the question, who is the target audience of SID? So clinicians, researchers, industry. One of the questions that we've had over the past year is, should industry, our industry supporters have access to this, and in what fashion? Who is given access, and how is that access adjudicated? And how often is the SID access reviewed? these things are all, they have a de facto understanding within our design document and within our, I want to say origination papers, but what do we have them called? Is it the SID expectations? We have a working edition of this in the SID expectations, but I think those can all be pulled into this policy and procedure. The where question can answer something that anyone who's going to peer review this is going to ask, which is where is the data stored? Not necessarily a physical location, but more of a metaphysical location of who owns the data and who's responsible for the data fidelity. And then a when question would be, when is the data considered complete? And that is a push that I'd like to make to create 18 months worth of data that's already in there and say no longer can we edit these entries, and now researchers can now use this as a completed data set to start to ask and answer their questions. Another thing that the policy would probably help to sort out is who adjudicates access for research purposes. And I think that, again, all of these can be discussed. I would think that should be outsourced to another committee, such as the research committee, evaluating a research proposal and then giving access to the SID. But that also means we need to build in how the software engineers' time is going to be managed, insofar as, are they going to be spending their time building the database, or do we need to actually have a project that they build a database exporter, so to speak? We have a rudimentary one where you can export local data, but any full database data set that is requested would have to go through a variety of different intermediate steps and ultimately be handed over to the software engineer to take some time out of his day doing his other jobs to then cull this data and then send it. So I think there are a number of really good questions, and my challenge to the rest of us on this phone call is, if you can brainstorm any other questions that a policy type document would be able to answer, and can email them to me or email them to Sarah Ann, what I plan to do is I plan to bring a working draft of this to the next meeting, so that, or actually to circulate it before the next meeting, so that we can then talk about where this document is going. And my goal would be to have something as a draft to present to the board in about 4 months time period, and a finalized policy document by the time of the next meeting this coming spring. What are your guys' thoughts on that?
Well, thanks, Chris. That's amazing. First of all, I'm very honored to be here. It's my first meeting. I must say I'm very intrigued, and I didn't know you guys were so dedicated and putting so much time and effort in this whole project. So first of all, that is amazing. I feel like I feel like we are very easy on all of our members and giving them a lot of space to participate or not. For example, I was just looking at the worldwide map, and I didn't see a single European center contributing. And I know for Erasmus, that's a data policy problem. But I feel like maybe with the whole new, when we're talking about momentum, the whole collaborative centers project is so popular, and we were handing out plaques, and I know that Matthew has hung his plaque very prominently in his office. So I think everyone's very proud to be a collaborative member, and I think we should maybe start with them making it more important to provide data. I've worked on some of the multi-center projects, and we were very easily giving other people's memberships on those papers, which I think is amazing. That's where a great collaboration starts. But with the whole SID, I think we're going to get so much out of it that I also feel like we should ask a bit more of those who are dedicated to CWIS. And I think the whole template start would be good, and maybe optimize that, as well as the whole data dictionary. So yeah, I'm very intrigued by all of your thoughts. So thank you all for that.
Absolutely,
Correct.
absolutely. One of
I'll
the
pop in
hardest
a- oh, you
things.
go.
Oh, go ahead. Go ahead.
Oh, well, I was just gonna say, on the collaborative center side, this first year, we were kind of in a pilot phase where we were trying to decide, we put forward some criterion, and that was really where that generated. But then we decided after the first 12 months, then we would relook at the criterion and decide, does this still make sense? Or do we need to do something else? And so that ended as of July 1 or June 30th, I guess. That had been a full year. And so now the executive committee is actually building 3 levels of criteria. So the base level will still be where it is right now. I mean, that'll be kind of a collaborative, I don't know, bronze or whatever. We're still discussing what wording that will take. But then the next level 2, has some other criteria, but to be the top level. And again, I don't know what we were talking about, like levels 1, 2, and 3, or gold or whatever, because no matter what you call it, there's some competing name. But anyway, to be at that top level of participation, that then they would be required to be actively entering data into SID. And so then we were trying to decide, like, okay, what does that mean? Is that, is it a percentage of your patients? Is it a certain number per year? Like what criteria do we use to say, or what metric do we use to say, okay, you've met this criteria, And so that's been one of the kind of soft debates as of now is what you have to, or what that means. Because, for example, both Intermountain and UNMC could put people in, but they're not, And so then, do they still qualify because they have access and they can, and I would argue that that's not enough. And so, we've just been going kind of back and forth about how to strengthen that process without making it too onerous, or something that feels just impossibly hard to achieve. Or if we do have some smaller centers like Dr. Martinson, who doesn't do a ton of cases, if there's a certain number he has to achieve per month, that's going to be much different than, if it's someone that has 3 or 4 surgeons operating in their facility, or, something like that. Like they're just different levels. And so trying to make them somewhat equivalent or somewhat equal for all people is not proving to be super easy, because we can find holes with no matter how you slice it, there's someone that's kind of being disadvantaged with this process. So anyway, the short story, I'm sorry to go on and on, is just that the executive committee is trying to figure out what that next version of collaborative centers is. And my goal is to have that approved by September 1st, because we're in the design phase now, and then we'll be discussing it, and then hopefully having it ready soon. But it would be nice we for sure want to roll it out at the mid-year meeting. They haven't decided on the name yet for NOFO. They're kicking around other names, but anyway, so once that name is decided, we do want the collaborative centers update to be in that meeting, which will either be late October or early November. So hopefully pretty soon that will help also spur some people, which is where the conversation then came up of, well, then if we're going to be requiring all these people to be putting into SID, then, we have to make sure that it's, we're making progress on the automation. And so that was kind of where I think some of the push and pull was coming from, in terms of moving this all together versus moving in pieces. I didn't want to require something if someone,
Yeah, I think it'll also
becomes super onerous. Oh, I'm sorry.
No, sorry. I was just saying, I think it'll also be easier to encourage more broadly to encourage data entry from especially like smaller sites and everything,
Yes.
as the system becomes more automated and we make more progress in those directions. So I think those parts are super important for getting cooperation, because people are very excited about this stuff, and I think a lot of the time it's a manpower
Yeah.
question, and a question of time spent and hours spent, because a lot of the time it is pretty tedious entering this data unless you have someone who can do it.
Yes. No, I
That
think
doesn't
that's
make it
absolutely
any less
true.
tieous. It just offloads it to someone
Yeah,
else.
just less
Right,
for
it just
you, I
makes it
guess.
someone else's problem. Yeah, you just kick that can all the way down the road. No, I think that's one of their concerns is, we've got all these people that are super excited right now about the Collaborative Center project or process. But then if we turn right around and make it super onerous rather than, or we make it so that it's almost, unachievable for someone that doesn't have a data, entry specialist or time on their hands to put it in or something like that, then we would potentially lose momentum in one project and the SID process. And, and so we were like, oh, we don't want to lose both at the same time. And so that was kind of why we were hoping to have, some version of automation or some version of making this easier by end of year, so that then as we were announcing the new standards, that then, it would dovetail nicely in terms of timing. But it seems like it's probably going to be a longer lead time on some of this automation stuff, since we're just having a problem even defining what it will look like, let alone, movement and implementation. So I think that may have been kind of a pie in the sky dream on my part, but we'll see. We'll keep at it is what we'll do. So
I think we're getting to a tipping point on this. I think we've talked about the automation aspect of it for a very long time.
yes.
And to a certain extent it was, and this is the kind of the conversation that we're going to have in a different forum, but to a certain extent, the automation discussion was a protected topic. Protected in terms of who was part of that conversation, protected in terms of the process, and also protected in terms of the accountability for whether or not progress was being made. And I think that if we're going to make the SID, and the SID works, I'm not saying that the SID doesn't work. It is a product that does reposit data, and I've seen the output of that data, and it's usable even when it burps out 10,000 or 100,000 data points into a spreadsheet. It's usable for researchers. So we have a usable product. We just need to make it more usable. And I think taking it to the next step is going to be, we're at a precipice of that, because I think the right people know the struggles that we're having. And if we're going to tip in the direction that we're continuing to go with this software engineer, then we will make progress. And if we're not going with that, then we will make progress, because maybe out of just pure frustration, I am not going to let this die on the vine.
Right. No, I think your point is well taken. And I think it is, obviously it's the rate limiting factor for the system, right? And so then when we look at it and say, okay, this project either dies or lives based on us solving this problem. So it behooves us to give it our very best to try to solve the problem, but that doesn't mean that, any of the solutions feel very clear at this moment. So I'm glad that it's a team approach, and I'm glad we're all focusing on it together. I feel like I've been jumping up and down in other circles, saying we need to do this, we need to do this, and then they're just kind of fragmented conversations going on. But I'm really glad that now we've got this cohesive voice saying together, this is time, and that the board agrees, the exec committee's on board, our committee's there, like we're finally all marching in the same direction. Now we just have to figure out what the end goal is, or how we get to that end goal. So I feel like there is definitely a lot of momentum. To your point, I think we've got a lot more momentum behind it than we have had in the past. So that's encouraging.
I don't want to distract from what we've been talking about, because I think this is a very productive discussion. But we also have one of the absolute masters of the research realm with us today, insofar as CWIS, with Dr. Prinz. And we keep batting around this word momentum. And I wonder if we could create a small slice of the data, a small study that we can just quickly pull out of the data that is available and process it and turn it into a manuscript as a rallying point for the first publication out of SID. We have a lot of data in there. It would also be a nice way for someone to practice using the data and seeing just how good or how bad the data is as a health check. And I wouldn't want to do something big. I don't want to do something great or groundbreaking. We can even find some like backwards little journal, I don't know,
Oh, as
Scandinavian
Dr. White
trauma.
says,
Something small.
every dog has a home. You just have to find it.
But just to get something out there that we've been able to wrap our minds around, but also test the system in a relatively rigorous way. And I do have a student, a master's student who's working with me that can help with this sort of stuff. But does that sound like something that would be a good idea, or is that totally distracting us from the purpose of what this committee is pushing?
But wouldn't that require kind of, like you were saying before, closing off, like closing some of the data, like marking it complete as it were, which would
It could be a test of a closed off data set. Right now, I'm looking at the numbers that we got in there. We have 1,400 and 1,481 patients. We could very quickly run the numbers to see which ones meet a threshold of completeness, and say, hey, here's a test data set of a locked data set, probably a round number. 1,000 sounds very reasonable to a lot of people who are reviewers. And just find out and see whether the product that we've created is usable.
I think it's a good idea for the very fact that it might show people this is possible. You know, I mean, we all believe in it and we're drinking the Kool-Aid and all of that, but it might be a really strong way to move it forward with saying, this really is a thing and here's a product from it. You know, I can see that being very helpful, because I think on the flip side, you know, I've heard from a couple of our collaborative centers, like Dr. Everett Erickson is one of them, who doesn't have the resources to enter people, and they're happy to sign the contract once we have an easier process, but they won't do it for now. And so he's like, yeah, we just keep it on the side. We'll figure it out later, you know? And so that's kind of I think the sentiment is there of, we already have an easier solution. So why would we make it harder? But if we could demonstrate that this system does something unique, or that it has some benefit that is otherwise, you know, not, I mean, like the heat maps, like that's obviously unique to SID. That might be a good way to then show something that's better than just using it in REDCap, you know, or better than just dumping your data in REDCap. And so I think that would additionally be a strong point as we figure out what data points to look at.
It was just an idea. Why don't we have that as kind of a closing sort of comment, or a closing sort of idea for our next meeting? Just brainstorm a small idea, things that we could do to test this out. And it looks like our next meeting is shaping up to talk about the updates on automation after we have our side conversation. Taking a look at the list of updates that are ongoing.
Yep.
For accountability purposes. And then I will bring back a draft of a SID policy that we can start to look at. Anyone else have any other ideas or comments, concerns, questions?
Oh, sounds amazing, and I really like the idea on working out a first publication. Definitely in for that. What also would be good, I think, maybe before doing that, or it would really help to optimize that data dictionary we were talking about. That's always a thing we started with in at the Erasmus. Just work out your endpoints, work out your units, work out everything you want to know. And I mean, we already know what's in SID, so I don't think it would be too hard to optimize the data dictionary. And from there on, we just have a clear overview on what's available. And from there we can work on what do we want to add to the publication, what's new, what's innovative. Yeah, I really like that idea.
Dr. Prince, could I send you the working document for the data dictionary to you to take a look at for commentary for next time?
Definitely. Sounds
Okay.
good.
Thank you. I'll put together just the debrief of the meeting and make sure that it goes out. If anyone has any changes or additions, let me know.
Excellent. Sorry for talking your guys' ears off. Thank you very much for joining us.
Thank you. Good to see you guys.
Yeah, thank you guys.
Have a good
Thanks
day.
all.
Bye-bye.
Bye-bye.